All right, so next case is a woman that I've seen a couple times. She's new to the office. She came in May, 50-year-old female. She was diagnosed with hypothyroidism by an endocrinologist 18 years ago. She was having weight issues. She was diagnosed with fibromyalgia, vitamin D deficiency, blood pressure problems, and I think she found me just actually researching on the internet. So her blood pressure was diagnosed recently a year ago, and she essentially had a hypertensive crisis at home. She was having a lot of foot pain. She woke up with it, and she got a cortisone injection, and that kind of threw her over. So she had a hypertensive crisis. The doctor put her on medication, and I don't know ultimately if her blood pressure was truly controlled at that point in time. She was diagnosed with Hashimoto's thyroid issue, so there is an autoimmune component to her hypothyroidism. She was having periods at 50, so they were regular 24, 28-day cycles, but they were very heavy. She was getting headaches, PMS, breast tenderness. Her fatigue was definitely worse with her periods, because they were so heavy. She had some weight gain of up to 25 pounds in a year, tired after she was eating. She has, numbness in her hands, some nerve pain in her feet for 1.5 years ago. And she did start seeing a chiropractor, but only saw the chiropractor once when I initially saw her. So a lot of fatigue. She would nap for 2 hours, still fatigued. Some symptoms of, acid reflux, sore throat in the morning, hoarseness all the time. Her jaw definitely was out of alignment as well, so there might be some clenching during sleep. So we did some labs. We did urine saliva testing, and I told her to talk to her chiropractor about getting her jaw adjusted. So in June, she came back and we reviewed her labs, and we went through urine saliva tests. So A1C, 5.4. Again, I like to see that 5.0 or below. Her ferritin, looking at iron stores, was 19, which is low. I like to see that 60 or above. So definitely, she's going to have some symptoms of iron deficiency anemia. We did let's see what else we did. We looked at some pancreatic enzymes. That looked okay. Cortisol levels definitely bottomed out during the afternoon, which was causing a lot of her afternoon fatigue. Definitely some conversion issues with her neurotransmitters. Her estrogen levels were high. Her progesterone levels were significantly low. The range for progesterone, 127 to 446, she was 96, so very low. So definitely estrogen dominance was going on. Her testosterone was low, DHEA was low. So hormones were just not balanced. So ultimately what we did was we did some SAMe from a neurotransmitter conversion standpoint. We maximized vitamin D. We did some DIM detox, which helps to lower estrogen levels and decrease conversion to estrogen. We did some pregnenolone to help increase progesterone levels. And we did some zinc, dealt with the insulin resistance. And we talked about doing some labs in 6 to 10 weeks. So I saw her 2 weeks ago, and she did not do any labs. She came in, she was having some wrist pain, and she was afraid to get cortisone injections because of the hypertensive crisis that she had when she had the cortisone injection in her foot. And she was feeling a lot better in regards to the fatigue, the anxiety, the shortness of breath, the sleep. And so what I like to do when I'm dealing with hormonal stuff is I like to, give it a couple months to see what we're going to do from a hormonal standpoint. Her periods were pretty regular, 24, 26 days. We were focusing on getting rid of the headaches, the PMS, the breast tenderness, the heaviness, the fatigue, worse with periods. And so when I saw her again in August, she, has had a couple periods, and her periods were still regular. She wasn't having the headaches, the flow was less, her moods were better. But now she's pregnant. So she came in, and she was 3 weeks pregnant, turning 51 in, the following week. And I said, don't blame me. This is not on me. Takes two to tango. My job was to get rid of those other ancillary symptoms. Well, she's excited. She's through the moon that she's pregnant. We did do follow-up testing, and, hormones look really good that way. I sent her to go see my OBGYN friend, Dr. Epperson. So hopefully she is following up with that. And, we'll see what happens. So, it's interesting because when you help people, or I should say, listen to the body, get the body back to where it should be, I guess anything should happen. And, in naturopathic medicine, I got nothing for birth control. So that's definitely on her and her significant other, not on Dr. Nickels. So I can help you with your hormones. It's just you need to help with other things. So that is kind of my take-home message. You never know what can happen. When your body's working good, your body's working good. So till next time when we do a day with Dr. Nickels, play it safe, my girly friends, even the ones in their 50s. All right? Till next time, take care.